So in this video, I'm going to talk about why you might get back pain when you're training abs. But before I get into that, be sure to subscribe, hit the notification bell so you don't miss any future videos. So with that being said, why might you get back pain when you're training abs? It's something that we commonly get with patients when they're coming here to the clinic and saying they tried training their abs in certain ways, planks, sit-ups, etc. Now, if you've seen any of our other videos, you know some of those exercises we ask you to steer clear of if you are training to sort of strengthen your back. But why might you be getting this back pain in the first place? And commonly it's right at the bottom of the back where your belt might be sitting. And that is really this lower region down here in the spine. And what's invariably happening with those patients is they're failing to actually engage their core correctly. And I'll get into what you can do about that later on in this video. But what's happening is you start out with, say for example, you're doing some crunches or some sit-ups or something like that. And you start out with a nice solid engagement of all the core muscles through here. So it's primarily this sort of motion. You're bending from the hips as you lift yourself up, or slightly reducing the lordosis during the exercise. And as you start to get towards the end of the reps, you start to lose that solid engagement around this section here, and you start to get excessive hinging at the lumbosacral junction. So it starts to bend through this part here, and you start to wear and irritate that lower back, putting a lot of pressure straight through one particular joint. Whereas if you keep your core engaged the whole way through that exercise, you don't ever focus excessive motion on one particular junction. And the lumbosacral junction, the L5S one, is one that is commonly the site of disc injuries, slip disc, herniated disc, bulging disc, etc. The cause of sciatica and other problems that where you get lower back injuries radiating down the legs. And it's something that really can be so easily avoided if you understand how you're doing your exercise. And that's when the focus shifts from the contraction of the muscles and the engagement of the exercise correctly to just trying to focus on the choreography. I look like I'm doing it, but in actual fact, you're not engaging those muscles effectively. So what can you do to actually minimize this as a problem going forwards so that you make sure you do keep that engagement through your core? Now, first and foremost, you're looking to re-engage whenever you're doing any sort of core exercise, is re-engage the deeper core muscles to provide stability for that lumbar spine and then do whatever exercise it may be. And by engaging those muscles, it's like a corset tightening around that midsection. And quite commonly you might feel it slightly in the groin down here, that engagement and that tension building. And if you pop your hands on your waist, on your midsection just here, you'll feel those muscles tighten up and it'll compress rather than stick out. Sometimes when people just engage the six-pack on the front here, you feel that the stomach, as you tighten it, sticks out a little bit as you tense it. Like for example, your bicep might stick out when you tense it. You're not looking to engage that muscle just yet. You keep the deeper muscles engaged and then go and engage that exercise. So doing exercises like vacuums can be particularly helpful here, where you lie on your back with your knees up and just focus on engaging and holding that core and then relaxing, engaging and holding the core and then relaxing. It's something that patients, when they come into the clinic, really struggle with. They don't have the ability to engage the deep core muscles. Even if they're people that say have been bodybuilders, we've had powerlifters coming in here who cannot engage the deep muscles. They're used to using the large prime moving muscles and not using those deeper core, small core muscles to engage and support their spine. And that is why they get back pain when they're doing ab training. They're just focusing on the large muscles and not getting that core engagement. So practice that exercise at home, engaging these deeper core muscles through the vacuum, draw everything in nice and tight, hold it there. You might get a bit of cramping sensation on the front or on the back at the base of your spine, or just up here where the rib cage starts. That's entirely normal. It's just where those muscles anchor in. These are the transverse abdominis and your oblique muscles. Hold that, go through 10, 15, 20 reps, and then relax. And you can either do it separately or before you start your core exercise, and that should provide much more stability, get your head in the game with regards to what muscles you're supposed to be using, and decrease the amount of back pain that you're getting while you're doing your core exercises. Now, hopefully you found this video interesting. If you have any more questions or specifics with regards to your circumstances and some nuanced advice, say pertaining to specific exercises, then do feel free to comment those below or reach out to us through the clinic for some more specific tailored advice. Thanks for watching. Thanks for watching this video. I hope you found it interesting. Now, if you want any more of our videos, then click here. We've got a nice one on our Back in Shape program. Up here, you can look at some of our recently uploaded videos. And remember, click up the top above my head for the link to subscribe, and do that so you don't miss out on anything in the future.